welcome everyone. We've got people joining us on the Zoom. We've got people coming from Facebook. It's good to see everybody. I'm Ben Ceccarelli. I'm the Chief Brand Officer at StemWave, standing in for Tom. We also have, I know you see Tom's picture here. That's Helen, our assistant. She's going to be kind of recording this Q&A session and managing all the technical side. But really excited to have everyone join today. We have a very special guest. We've got Joe Millen, who's a physical therapist who's been doing this for a long time. It's really great to get all different types of medical professionals to talk about their experience before and now having StemWave. We talked to chiropractors, we talked to MDs and PTs. So without further ado, welcome, Joe.
Hi. Hi, everybody.
So, Joe, let's kick off with having you give us kind of like an idea of your journey, like pre-StemWave, just how you started your practice, how you got into physical therapy, and kind of what you're dealing with on a daily basis in your clinic.
Okay. Well, I've been in physical therapy. I graduated actually in the old world. In 1985 is when I graduated. So the PTs at my time we were bachelor's degrees, and the but I've been in pretty much private practice my entire career. I did a short little stint with some corporate companies, but Um, I've mainly been a manual therapy, sports medicine type focus, although my practice now is very eclectic. I have people that have strokes, people that have had nerve injuries, let alone chronic arthritic stuff. I'm now, for the last 25 years, have been a cash physical therapy practice. So uh, I jumped out of the insurance world for the most part because I felt it was directing physical therapy in a direction it didn't belong, or even general medicine and healthcare, where we were all financially focused and not focused on clinical outcomes and why we should be doing this in the first place. So, which kind of brings it around to why I'm doing StemWave. I was looking for things that would adjunct to my involvement with people. So I have people that have been with me as a clinician for 25 years. I mean, clients who've been with me for that entire journey in the cash pay world. The people also come in for short stints of care as well. But the biggest problems I was having were people with chronic arthritic joints, old nerve injuries, old strokes. And so I was looking for, when I was doing some research on uh, what could assist me in doing it. Because at my practice, I do a ton of hands-on work. I do what I call manual resistive or manual interactive training. So I learned how to do joint manipulations and all of those kind of things. I did something with Brian Mulligan, which was called Mobilizations with Movement, which is literally just repositioning the joint while you then train it, and all that kind of stuff, along with all of the neurofacilitatory stuff that we learn to do work with people with strokes and nerve injuries and all that kind of stuff. With all of that said, I could do many things. I could not convince the body that it would go heal that arthritic joint or that tendinopathy. I could put it in the right position, do all the things that I could train effectively to work on the loading, but then I couldn't get it to jumpstart that. So that's when I started getting looking. I had a K laser, which was a class 4 laser. Unfortunately for me, it got stolen, but in some ways it was serendipitous, because then I had to go looking to say, do I want to replace that? I had the K laser for 8 years. I was not seeing progress in some of these chronic conditions that I looked at. And so I was interested in trying something different. That gave me the opportunity to then talk with Ben Lewis a little bit. He facilitated me getting a lot of information, listening to Dr. Manison talk about, and I think he and I are very aligned on, I wanted a tool that would assist me in the rehab. Obviously, in many ways, the STEM wave does things that can create the healing process that somebody needs, but correcting the biomechanics, correcting the physiology so that the tissue can finish healing is one of the key factors. Um, I had a lot of background, just so people understand where I'm coming from. I did hands originally out of school, so people that had um, tendon lacerations and their arm cut off and things like that. That was my initial rehab background, and then I got into more sports medicine, orthopedics, backs, necks, you name it, kind of thing. But the original rehab in doing shoulders taught me I had to understand tensile loads and stresses on tissues, which made me always come back to think of the microbiology and the physiology that's going on in the healing process, which again wraps back to StemWave. When you look at the research and the fact that uh, when you go and dive into it, it's very interesting on everything from nerve injuries to uh, working with even stroke patients. So I have those to as in my repertoire to trial. Just to give people a kind of a quick synopsis, when I was looking to make the decision, the 60-day was a big deal for me to be able to look at it. We ended up buying the machine outright, but the having the 60-day clause in there to say, hey, if it didn't work, you could do that. If I had a chance to go back and tell the Joe 2 months ago what he should be looking for, I would tell you that it was to see first and foremost, was it effective with my current clientele? And I have 50, 60 people that are active clients. So that was my initial clientele. That clientele I then have introduced the StemWave with, and I will say that 95% of that clientele is benefiting from the StemWave and using it. I have a few that are modality averse, and so we're not doing it. But other than that, it's been phenomenal to see the differences that I've seen in chronic arthritic shoulders that I was beating my head against the wall trying to get motion and that type of thing. This really made a huge difference in being able to get that kind of breakthrough experience with somebody. And then they were more open to all the other therapies that we had to do.
That's amazing. So 1985, you've been doing this for a long time. You've seen probably almost everything there is to see. What were some of the things that pre-stem wave was really tough for you to see results with?
Well, I mean, pre-stem wave, I mean, it was these chronic arthritic conditions. It was the people where the only alternative was going to be in going in and replace the joint. I mean, they basically, uh, I teach a whole different philosophy of how to train people. I'm not the classic physical therapist in some senses that I don't teach a recipe. I try to teach my clients that the simple thing that I tell my clients is I learned anatomy, I just didn't learn my own. So, and what I mean by that is most people are lousy consumers of our work. They have no idea what good therapy, good chiropractic, good medicine is. They take your word for it. And so a lot of people get what I'll say is subpar care because they're not a good consumer. So the example would be is that you have somebody who's been post-op having an ACL repair, and you have them doing simple things like a quad set, but they're not firing off their quad. They're doing the exercise, they're straining their facial muscles, but the quad itself is not firing. Well, then it's a waste of time. So in treating this, I mean, found, I mean, I've used pretty much all modalities from back in the day. It was diathermy and ultrasound and electrical stim when we were doing exactly what the Russians were doing with high intensity electrical stimulation in order to facilitate muscle contraction and all that kind of stuff. But what most people don't understand about that research is they were exhausting the person first. They were athletes, and then you were shocking the muscle to the point of fatigue. So,
Yeah, that's like the
uh,
stuff you see in Rocky Four. That's like the same
yes,
stuff. Yeah, that's the stuff you're seeing.
yeah. So we've done a lot of those type of rehab, and like I said, the most recent with modality wise was I've done microcurrent. I've used, I mean, always searching for the thing that would give me that added little clinical advantage. Because if I was doing all the right things biomechanically and trying to engage the client in their health and giving them a better understanding of their own body, I also needed to find those things that would get them past the pain threshold or change that or change. And so the big thing for me when I started using the stem wave was yes, it gave me almost an immediate change in the joint physiology. So Dr. Manison and I talked a little bit back and forth on that through the school, but I know he's focused on doing this stem wave at the end. But I was incorporating it in the beginning with, particularly with my neurological clients and the ones that but even because I knew all their physiology, I knew what I was doing from a treatment standpoint. So I would do the stem wave first. because I wanted to feel what the change in the joint was, what the change in the muscle response was. And by doing that, I didn't take them through an aggressive training regime. I was looking at it when I do exercise with clients, I tell them we're trying to be anti-inflammatory. We're trying to facilitate getting the swelling out of the tissue. We're trying to work on the physiological changes that we're looking for, not reps, sets. I'm not even thinking of strength and flexibility yet. I need the muscle to fire first. So what I found with StemWave is it actually changed their physiological response. I could get a much better muscle contraction out of somebody because they weren't protecting it. The other thing that was kind of fascinating with it then is that as I started going through and doing StemWave on, say, a rotator cuff, shoulder issue, I was finding that as I was tracing out the infraspinatus, I was finding areas that I was missing in my exam that were painful to the patient. For example, on the muscle belly of that, where the muscle tendon junction was on the infraspinatus, once I went over it a few times with the stem wave and I got a painful response from somebody, I noticed, well, there was a localized spasm there. And most MRIs are not going to pick that up because they're not necessarily looking at the muscle belly. They're looking at the insertion into the bone. So it actually has helped me from the standpoint of becoming a better examiner. And believe me, I have my hands all over bodies every day. And I'm different than most because I work on the entire body pretty much every time they walk in the door. So
Yeah.
so anyway, that's probably more than you wanted to know, but
No, no, this is a great time for you to share every aspect of your journey. But I think that's a great point, and we'll get into more of that later about the diagnostic attributes to StemWave, how it can actually in real time give you feedback, biofeedback from the patient as you're using it. But what I think is really cool to touch on right now is you have like tried, it sounds like almost every type of gadget modality. You mentioned, doing the electrostim stuff. You talked about how you had the laser and it got stolen. And by the way, if that's what triggered you to get StemWave, we didn't steal it, wasn't us. I'm going to say it on camera so we have it on record.
yeah.
But so once you made the decision, like I'm going to look into StemWave, what were kind of your expectations? Had you heard about this type of therapy before? I know that you're really big into some of the research that you mentioned that Madison shared with you. Just talk a little bit about like coming into the device. How much knowledge did you have about it?
Well, I had no real knowledge of it. I mean, in some ways, I was a jaded old clinician in the sense that I was tired of some of the research that was out there because I was seeing a lot of stuff that was just uh, it it really wasn't helping me enhance my clinical practice. Um, so in many ways, that initial dive into the extracorporeal shockwave and having to understand radio waves versus what we're doing and everything else was in some ways new. I mean, it wasn't like I hadn't used a Theragun and hadn't used other types of modalities that were, more radio wave oriented. But understanding the physiology and understanding the mechanics, I'm still a scientist at heart. So even as we do things, I want to see clinical changes in the things that I'm doing that are more science based. So once I started diving into that research, I will tell you that in some ways it revitalized my interest in doing research. So, I mean, I'm constantly now on doing more research, looking at things because I have clients who have a variety of different problems. I mean, I'm not just seeing a bunch of post-op shoulders. I see people that typically are coming to me because they failed everywhere else. And I'm their kind of last hope to go see if somebody can figure out what's going on with them. So the STEM wave has been a great kind of shot in the arm of my interest in going in and studying. So I actually put a lot more time into work now than I was. I mean, and I have a small practice. I obviously I'm a small business owner. We all run a lot and do a lot of work. But I would say that the STEM wave for me, it it just it set itself apart in the way that uh, what the research is showing, and obviously a lot of the research is coming out of Europe and other places where they've had it longer periods of time, but the that really gave a jolt to my practice. It's gotten me more excited. about some of the things that we're doing, and to go back and research about how I can do it better. I mean, the journey from having started using it and doing the mapping and doing everything that we would do, and then understanding the pulses, as we talked a little bit about, you start to then learn where those areas are, how much you need to actually hit that area, at what intensity you need to hit the area. And that's where, StemWave has a great team of people to help us kind of know what questions to ask, or get that feedback from the docs that are giving us insight into how they've been using it. Dr. Manis in particular, on the research behind it, and how to be careful of even kind of overdosing, if you will, on pulses, and or backing off on the intensity, and doing more pulses, and then looking at the physiological response of how your patients respond. So
Yeah.
that's been a very interesting journey for me to then, and that's where I can tell you StemWave has been significantly different than any of the modalities that I've used in the past, as far as seeing true clinical findings change in a very short period of time.
Yeah, I think that's a great point too, is that, for anybody that's new to hearing about stem wave or acoustic wave therapy, there's a lot of research out there, and our team can provide you, just like we provided Joe with it. This is not something that is still like very unknown. There is a lot of data out there. You can read it for yourself. It may reinvigorate you into researching like it did for Joe. Um,
Mhm.
so that's great to hear that it was really like the data that made you feel comfortable moving forward in the process. So walk us through a little bit about how that process worked for you, as far as like deciding that you wanted to bring StemWave in, and what it was like to actually like get it into your clinic and start using it.
Yeah, I mean, it's it was a I got excited about it from a clinical standpoint. Then my wife and one of my sons is involved in the business from the business side of the equation. So now I have to then convince them that it's worth taking a risk to say, hey, we're going to bring this in. So that's where the 60-day trial, and you have to do 50,000 pulses in that period of time. Just so people have an idea, I did over 500,000 pulses in that same period of time. So
Wow.
uh, I used it a lot in this very short period window that we were talking about. And it's been, so in making that decision, I wanted to see in this first couple of weeks, and it was interesting because I was trying to make the decision right around Thanksgiving, and we were like, well, maybe we should wait, not necessarily get it going. But then I had a chance to talk with Dr. Miller down here in Tampa, and she said, look, I brought it in and I made a huge impact in the first last 2 weeks of the year. She bought hers, and I think she said the last 2 weeks of the year she signed up $20,000 worth of uh, new people based on that. So that kind of helped convince me and my team to say, look, I went to the training before I got the machine, before I actually ordered it, so that I understood a little bit more about it. I actually went over to Dr. Miller. She's in Tampa, but yeah, I'm in Clearwater, so we're only about 30 minutes apart. So I went over there and met her one day. She opened her doors to me so I could try it out. And myself and my wife, with a few conditions that we had. Had a shoulder issue that I was having trouble healing. I think it was more of a labral, a little bit of tendonitis. It was improvement on the first session. My wife has had a chronic issue with her foot, and it made a difference on that very first day. But it's not necessarily like a home run and you're done kind of thing. It just gives us that initial sense that, okay, you could find the tissue, and that was one of the things that was helped me from as a clinician, knowing that it would actually help me locate where that tendinosis was, or tendonitis, or where the tissues were in a sense hot. You would find that person responding. I responded. So that gave me that little bit more clinical confirmation that, let me jump into this. We decided to go ahead and do it. We were in the position where we could pay for it, so we did. Uh, but knowing that we were on that 2 month trial. And then, uh, like I said, I probably had 50,000 pulses in the first 4 or 5 days. So,
Yeah.
but I already had a full allotment of clients who I knew would probably benefit from it. And so and we had some pretty cool responses right off the bat.
Yeah, that's amazing. For people that joined late, Joe runs a physical therapy clinic. But you said a couple things that I want to touch on that I think are fantastic. Um, First of all, our clinical advisory team is amazing. I'm so glad you got to meet Dr. Miller, and she's fantastic, and she opened up the doors and got to treat you. Joe mentioned that he went to our training, and so when you are in the process of getting StemWave into your clinic, we do have these group trainings where we train you on how to use the device properly. You're there with other providers, all different types, and you all learn together, and you get to do StemWave on each other and yourselves. And so Joe, you're mentioning that you had a shoulder thing, you felt something right away. That is very typical. And one of the benefits of StemWave is patients or anybody who's trying this, if you're trying on yourself, you do feel a decrease in pain and increase of range of motion right off the bat. That is something that we see all the time. And like you said, it's not a home run. Obviously, there's a care plan that follows that. But that initial response, that's what gets people excited. People that have had chronic injuries like you're mentioning.
Right. Well, I mean, one of the big things that I was always taught as a clinician is you needed clinical confirmation of why they were in your place, right? It's one thing to say, that somebody complaining of pain. It's another thing, can I substantiate it? So the cool thing about the stem wave is it substantiates their pain. You'll find it. If there's somebody who doesn't have that issue going on, over normal tissue, you don't really have it. You can feel the pulsing, but you don't feel any significant kind of discomfort or an awareness, an electrical shock kind of feeling, because there is no electrical shock going on, but you might feel something like that in your body when you're hitting it with this acoustic wave. And it makes all the difference as a clinician to go, hey, I found that spot. Just like when you're going over the condyle of the knee, you one of my clients recently came in at post surgery, and he's done extremely well getting swelling out of his leg post surgery. And I could tell you exactly where the doc debrided his knee, where the cartilage was thinned a little bit, and he did some work because it lit up when the stem wave hit it. I mean, so
That's a
that just tells
diagnostic.
me,
Yeah, that's what
yeah,
we were
so you
talking
have
about.
that diagnostic piece that brings in, some of that substantiation. So if the clinician then translates that well to the client to understand, hey, we found your problem, there's a good chance, I mean, we're almost assured that this can help you heal. That helps them have the confidence, you have the confidence going forward that, and you start to see fairly quickly that tissue change in the response to the treatment. It becomes much less uncomfortable over time.
Yeah. So we talked a little bit about already like that we have these group trainings. We train you on how to use the device. Can you give us an idea for you? What was the group training like for you, and like how easy was it to learn how to use StemWave?
Well, I think for any clinician who's used modalities in the past, like an ultrasound or something like that, obviously you can refine your technique, but you understand that aspect. I would say that it's very easy to use. I mean, it's nice to see it in person because you understand the weight of the head and you get some of that experience. You see what it's like to change out the saline solution, and you get a sense of comfort with the machine, but it is a very easy machine to manipulate. I think the big thing is you also understand fairly quickly because in the class you'll find people, all of us have issues. None of us are spring chickens anymore. So everybody typically comes with an issue, an arthritic problem, a tendonitis. And we saw some amazing things in class. So that's the other thing that's nice for everybody is you have objective clinicians who are all looking at this from the standpoint of tell me, you know, looking for a reason to say I'm not going to buy this to then seeing amazing changes. One of the guys that was in my class had strained a muscle doing jujitsu. The couple days before he came to class, he flew from California to Tampa, and then during the treatment, while we were there, Dr. Miller treated his strained muscles, and he got almost immediate relief where he was, kind of an 8 out of 10 pain sitting in class. He had almost complete resolution in the first session there. Um, Now, the interesting thing about that is he then became aware of another area. We treated that, and then that also calmed down. So a lot of times you'll see that with the clients is that you treat one area and then it changes that particular area, and other sites where they're having problems start to become easier to recognize because you've taken one thing off the shelf, so to speak, and now I can start to see other things that are left there. And so the use of the Dr. Miller and the team that you have do a great job of explaining the physiology that's going on, but also just the very simple aspect. And then getting the experience with it just helped me feel that much more confident. And knowing that in the future, as if I have staff that's going to take over and run it, then other clinicians, they can go to the class. That's a huge piece for me. Yes, I can teach them, but having that outside person also be there so they hear it differently, I think is very valuable and a great gift from StemWave.
Yeah, I think that's a great point too, is that if anybody has other staff in their office, those staff members can come to training and get trained on the unit. And then it doesn't have to be all on you. Now,
Right.
you talked about how in your practice, you have this experience with manual therapy. That obviously takes a lot of wear and tear on your body as the clinician. How has StemWave helped you kind of preserve your career now, not having to spend so much time doing manual therapies?
Well, I mean, it's been kind of having been doing the stem wave like with say over this spine and working there and then coming back and doing, I would say I can change the amount of work that I have to do to get the joints to move well. So so doing just gentle PAs or gentle motions to mobilize the joint, when you do the stem wave first, the joints change. I mean, it's almost like they're hyper lubricated. And so you don't have to do an aggressive technique. You don't have to be, kind of really working on the tissue as much. And I find it creates this better dialogue between you and the tissue and you and the patient of I can be less aggressive. So in that sense, it's easier on me. I mean, fortunately, my body was, I guess, designed to do this work, so I haven't had a lot of issues with it. But on the other hand, it definitely makes the manual therapy and the exercise side of the equation much more effective with a lot lighter techniques.
Yeah, absolutely. So that's fantastic. We see that a lot with, especially with our chiropractors. This really helps prolong their career and their practice because it's the wear and tear of doing manual therapy is now replaced with a quick 5 to 10 minute stem wave treatment. It's like changes their whole perspective on how they can run their practice. Um,
Right.
you talked earlier as well about you've tried all these other devices, in your long career. And we know at StemWave that we're so different because we're not like typical devices where you get the device and then you never hear from us again. Can you explain a little bit about what it's like working with StemWave as far as how we support the providers through the journey?
Oh yeah, I mean, that was one of the I'll tell you, it's a huge difference between my experience with K laser and what my experience has been with StemWave. StemWave is head and shoulders above anybody I've ever worked with on in all the years of even buying microcurrents, other things like that. As far as that first 6 months of training, and I'm only a couple of months into it, the the actual clinical work, the ability to listen to all these different coaching calls, so you have other clinicians bringing up questions about what they're experiencing, having problems, and you have both a written dialogue going on, and then you have the actual coaching calls where you have something like this where there's people able to ask questions and you get the doc who's been using it for a while to give you some responses. The one of the other major pieces that we've really enjoyed is the marketing side of the equation. I'm I've been in business a long time. I will tell you that's not my best suit is do, and unfortunately in many ways I've been a great secret, and that doesn't help business. The so StemWave in that sense is having a real strong marketing team about how to get us known, being effective in that marketing. Uh, I will tell you that we're only in the beginning use of it because I wanted to make sure that I had good clinical experience in my first 2 months of using it, get my own clinical confidence up, see the change on my current clientele. But we're now moving very aggressively to utilizing all of the things that StemWave provides on the marketing side of the equation, let alone the actual technical clinical side of using it and making sure you understand the dosing and that type of thing. I think the more a clinician is interested in really using this and developing it into their practice, it becomes uh, a huge piece. I mean, I know Dr. Miller is doing primarily STEM wave and has been able to kind of use just corrective exercises to go along with it, and she's having tremendous success. And I can see in my practice that the STEM wave will be, I think, a critical piece of where this company goes going forward, because it's been a very effective tool just in the first 2 months to provide not only the healing aspects of everything, which then you realize the body then doesn't have to do all the other compensations it was making to protect that area. And that's, I think, one of the fun things for a clinician is to go, look, hey man, now all this other stuff that I'm doing is sticking. It's actually doing what it needs to do because the body's not going back and protecting this injured tissue because it's no longer injured.
Yeah, I think that's a great point too, just to touch on the marketing side. So, we know that you guys have so much to focus on as far as just getting people better again. You don't have a lot of bandwidth to think about how do I now market this device. So we do have an entire department dedicated to helping you market StemWave. We assigned you your own dedicated account manager to, I think Sydney was yours, is that right?
Yes, uh-huh.
How is that
Yes.
work? How is that working with our account managers and our marketing team?
Oh, I'll tell you what, it is a game changer as far as a clinical practice because even within our in-house, my like I said, my wife and my son, one of my sons is a partner. I have 6 kids, so the thing is that having Sydney be there to kind of guide us, it's somebody who knows what questions you don't know to ask. So having that guide to kind of help support you, being willing to adapt to our practice, because my practice is different than a lot of other people's practice. So um, that's why the marketing team has been fabulous at being able to say, hey, here's how we can facilitate the way your practice is designed so that we don't necessarily change your culture, change all the other things. Unless you want to, unless you said, hey, I didn't have good culture or didn't have these other aspects. But the marketing team and Sydney is my account manager. She's been fabulous. My whole team loves chatting with her because she gives us, one, the energy that we're looking for, but also to help us navigate school, navigate the other aspects of really trying to integrate StemWave into our community and getting the message out there to folks that we're doing it. So we're just in the process of bringing a lot of these components in, but we've been very successful in the first 2 months recouping a significant amount of our investment. So I can't complain about that.
That's great. Yeah, I think it's important to mention, like you just said, StemWave is more than just a product, it's a community. So if you do bring StemWave into your practice and you're a StemWave provider, you get access to our weekly coaching calls. You have a dedicated account manager. You get help on the marketing side. We have a platform called School, which Joe just mentioned, where there's message boards and people post their wins and questions get answered. There's so much support that it's unlike many other companies where they just kind of drop the device off and then you're on your own. So it's great to hear that you've had such a positive experience. We have a fantastic team. It's easy for me to say that because I'm part of it, but to hear it from you say that means the world to us. Um, so now that you've been using it for a little while, just touch on a couple of things that you've seen StemWave be able to accomplish with your patients that previously was not possible.
So I'll give you, 3 different examples. One is the chronic arthritic joint. I mean, the knees have been low-hanging fruit. I mean, the chronic arthritic knees have responded amazingly well. And it's almost the only thing I can kind of judge is that it's like the fluid film layer of the joint is restored to actually give lubricant to the joint, and their pain is almost instantaneously better. And then the progression over time, you see this little kind of journey of how the knee is going to respond. And some of these joints are fairly worn out. So this is not going to be a short-term fix. This is going to be long-term, working on retraining their mechanics and all that kind of stuff. We've had amazing results with knees and shoulders with that kind of thing. I also have people with old nerve injuries, both related to, one was related to a hip surgery that they nicked a nerve, and the other was had a really severe spinal stenosis where he ended up with a loss of his plantar flexors. And these were old injuries. I've been doing a ton of manual work with them to retrace. They were barely trace anything when I started working with them. One was 3.5 years post surgery, one was 20 years past surgery. So theoretically, you were not supposed to see return in any of these muscles. But we were able to start to regain function. Uh, I was getting to a plateau with a gentleman who had lost plantar flexion. He's 80 years old, so he's not a spring chicken. And adding in the stem wave, we started seeing almost an immediate change. So I treated the muscle and I've treated the nerve pathway because the muscles change their physiology when they've lost this. And so long story short, we're seeing recovery there. So those are early on. Again, I'm 2 months into it with this, but the change in somebody that has an old nerve injury, let alone an acute nerve injury, to me has been amazing. And then I have people with strokes who I've been able to see a change in the hypertonicity and starting to change that using the protocols to treat those muscle tissue and soft tissue nerve, and that's been amazing. So uh, the the one that has been a home run almost every time is treating an Achilles tendonitis. I mean, it's amazing that I I'm blown away how quickly they respond as far as being able to stimulate the healing, and then they actually do a heck of a lot better with rehab because of what StemWave has done. And those guys, I've got 4 or 5 that I've seen in this first 2 months that I have yet to see one that hasn't responded
That's
extremely
so great.
well.
That's amazing, and I'm so glad that you talked about seeing really great results with nerve damage and being able to get some of that nerve feeling back again, even for cases that would be considered impossible. And we've actually
Right,
heard that with some of our other providers seeing big changes in nerves. We partnered with a clinic called Project Walk. They strictly treat spinal cord injury patients. What they're seeing with StemWave, with nerve recovery and all that kind of stuff is almost like magic. It's almost unbelievable. But it's so great that you have firsthand experience with that. So it's not just a story, like you're actually seeing it on a daily basis.
right, exactly. And I think that as a clinician, that's what energizes us. I mean, that seeing those wins, particularly when you get beat down, not seeing those changes, it's tough. So to actually have it, and that's where, for me, the STEM wave can really help a clinician kind of get re-excited because there is it, you see a change in the physiology, and then all the other things that you do clinically start to really pay off.
Yeah, I think it's important to remember why most of you all got into this in the first place, and that's to help people and to help people get better and live the type of lives that they know they should be living. And then that's what our mission statement at StemWave is to try to get that type of recovery for people, to get that type of healing, that regeneration. And yeah, the machine is great. It's cool, great technology. Yes, it will generate, we like to say between five to $25,000 of revenue every month for our providers. But besides that, like at the heart of all of this, it's about getting people better. So it's
Right.
really great to hear that you recognize that as well, and that StemWave is doing that for you, like it's doing for. We have almost 600 now out in the United States, and we have a 98% success rate with our providers that are using it. So it's pretty amazing to see that type of change. What I want to do now is shift gears a little bit. We have a few questions. If anybody has some questions for Joe or for myself, throw them in the chat. We have some already. So one of the questions is, should StemWave be used in conjunction with PT? I'm an FM doc that's also a DO, so I do manual manipulation for acute relief, but typically refer for chiropractic treatment for prevention, further treatment. How do your primary care physicians use benefit from this device? So you can maybe talk about using it in conjunction with physical therapy.
Well, I mean, to me, it makes sense to do it in conjunction with physical therapy. I mean, people have been doing it some as a standalone treatment, and I know that it has some benefit, but you're typically trying to correct the mechanics, whatever was the root cause of the problem to begin with that caused the tissue to become injured. So I'm a big fan of physical therapy, but not physical therapy that's kind of generic. It should be based on what are the clinical findings. Did you kind of identify where that was? Just to kind of give a quick, I do reviews on a lot of workers' comp stuff for a company, looking at PT notes. And a lot of times you're reading notes where they're doing stuff, but there's no clinical substantiation that it made any difference. The key thing about StemWave and integrating it into therapy is it can help in the healing of that tissue and getting the nerve response, but then you've got to do the work to actually get the muscle to fire. And the key thing that I would say, for example, like we were talking about the nerve injury, the patient can't find it. They don't know what they don't know. They can't feel the tissue. They can't learn to recruit it. So you need the physical therapy, or whoever is working with them, but physical therapists were supposed to be doing this stuff, actually retraining them to find the tissue. Just like I was telling you with a post-op knee, if I'm doing stem wave on that post-op knee, I think it will substantially speed up the healing process and get that person to recover faster. And Dr. Manison is big about, it should cut that time down by 50%. But he's also big about, but you got to do the clinical work that needs to be done to facilitate the recovery. So you got to correct the mechanics. So in this case, you got to make sure that the quadricep muscle is actually firing when you're doing the exercise, and eventually you get the sequencing back. So when I think of physical therapy, I don't think of it in this generic term of physical therapy. To be honest, I had the hardest time for a while calling myself a physical therapist because I saw the care that people called physical therapy, and you didn't need a degree to do it. You didn't need to spend your time becoming a master or a doctorate in physical therapy. If you're going to do this work, you should be doing it based on clinical findings and clinical substantiation of the things that you're doing. And that's why, for me, I became a huge fan of StemWave in this very short window, was because it makes the clinical changes that I need. So then all of the other therapy that I'm doing, exercises, corrective work, manipulation, all now actually the patient's going to see the benefit from, because I've corrected some of the underlying condition.
Yep, exactly. Retraining the brain, like Gary says, it's getting that connection back. Stem wave will do the regeneration and getting the injury back to where it needs to go, but we still need to make sure that the athlete or whoever it is moving correctly and that everything's talking to each other. That's a great point.
Exactly.
Um,
Exactly.
One of the other questions, what marketing outlets are you using? Facebook, Instagram, print, radio? I can speak to this after a little bit more, but just curious, Joe, like which marketing outlets are you looking to get into or have already started?
Well, I mean, I've been in this area for a long time. I've been in my area for 35 years. So my initial role was to go back to people that I already know in the community, just to say, hey, I have this device. And because for me, it's low hanging fruit. I go talk to that community. They start sending people for the STEM wave. I need to take the time to go out and explain it to them. And that costs me a little bit of my time, but I need to reconnect with my community anyway on a regular basis because it's good marketing. Um, and we're just now implementing, actually in the middle of February, we're going to start to implement the Facebook ads, doing those types of things. But we use the brochures. We've been basically taking our existing clientele, because my number one referral source is my own clients. So what we've been doing is using the cards and the brochures, giving those to clients, so they then have a way to communicate what we're doing to the community out there. And that was, for me, the low hanging fruit that we wanted to do in the first 2 months. And now the next 4 months and beyond, we're going to be moving to Facebook and Instagram and the other aspects of advertising. But um, I think people can do the journey any way they want. I mean, the marketing team is there to help you day one if you want to do any of those things. Print media, they've been offering it to us all along. We've just said, let me get comfortable with the machine first, and then I can tell you that from that aspect of marketing, the if you're excited about it and you really see that you're seeing the clinical changes, then when that person comes in the door, it's a lot easier to get them engaged and get them into a care plan because you have the confidence in what you're doing. And I can leverage what I learned from school, but I really needed that experience myself. And so that's if I had to go back and look at Joe 2 months ago and say, what was the main thing I wanted? I wanted Joe to have good understanding of the device, have success with it, with his current clientele, and now we'll go talk to the rest of the world.
Yeah, and I will say too, word of mouth is always the most fantastic way to spread the word about, StemWave. It doesn't cost anything. But in addition to that, our marketing team is fantastic. We do focus on Facebook ads, Instagram ads, but we have, depending on what market you're in, we've had a lot of providers do print ads, whether in magazines or newspapers, to a lot of
Mhm.
success. Some of them are doing just traditional mailers, like postcards in the mail, with info about StemWave, info about their clinic specifically. Um, I don't know if anyone's gotten into radio yet, but we've had some providers that are interested in doing TV spots. So
Mhm.
we're working with that. Everything from that to video billboards on the side of buildings. So there's a whole wide range of ways that we can work with you to market. And we have a very experienced team, very talented team. We provide you with a welcome box when you first become a StemWave provider that includes the trifold brochures that you can keep in your office or hand out. There's a roll-up retractable banner promoting StemWave. And then our team is just happy to work with you on whatever other materials you might need to become successful. I mean, at the end of the day, your success is our success.
Mhm.
We want to make sure that we're doing everything possible to get the word out about your clinic having StemWave so that you get more patients. More patients get the type of StemWave treatment we know is possible. They tell everybody, they tell their friends, and it just becomes this cycle where now StemWave is becoming a household name. And that's really what our goal is at the end of the day, is to reshape traditional healthcare and have StemWave be the option you go to when you have an injury or something chronic. You don't go the traditional route and say, oh, I must need surgery. Oh, I'm just going to be on pain pills forever. Oh, I need to get cortisone injections, whatever it may be. Um, One last question. Oh, we have a question about does insurance cover any of these treatments? If not, what kind of charge do you charge? And do you build a charge up front? So maybe, Joe, you can talk about how you kind of structure your treatment payments and what you charge.
Right. Well, I mean, I make it simple. I don't bill any insurance. So, I mean, I do occasionally see some workers' comp, but then they pay me my rate. So, um, with that said, I have clients that were paying $300 a session. That's an hour of my time. Then I added on, when I was doing StemWave with them, I added on $100 charge to that. So then that way, then we would cover doing the StemWave within the session, that type of thing. We have people that are coming in just for StemWave. So we have an initial eval. Um, I've done mine a little bit different because I'm already fairly booked, and it's only me. So normally StemWave offers a $50 initial consult and treatment. I did it differently. I give them $50 off. So it's usually a half-hour session. So it's a $200 session they get for $150. So they get that initial exposure. So far, that's been working well for me. I know people have done extremely well with the $50, and then you get somebody on a care plan. Essentially, what we do is we charge for one joint is $175. Two joints we were doing 250, and three joints people do between 300, 350. So that way you accommodate for your time, the usage of pulses, and all the other things that we go along with it. Uh, Typically we're encouraging people that are coming with lower body stuff to do both knees if their other knees not necessarily giving them problems. So you're typically billing them, for the two joint stem wave in that period of time. And those are 15-minute segments to half-hour segments, depending on what you want to do. But it becomes in the beginning, I think it's really important to not necessarily put yourself into production mode to make sure that you feel like you're generating enough revenue that it's covering your cost. You're seeing the changes that you want clinically, and then you can develop more efficiencies and get it where you're, you know, keeping the stem wave rolling the entire hour.
Yeah, I think also this kind of like works into what we were talking about with marketing, depending on your location and kind of like what your clientele is. You can vary what you charge. We kind of leave that up to the providers. We can offer guidance. I can tell you that many of our providers, they do that introductory treatment for like $49, $50 because they know it's a low barrier of entry. The patient's going to see that increase in range of motion, decrease in pain right off the bat, and it's going to be much easier to get them into a care plan of like 8 to 10, 12 treatments, whatever it may be. And then those treatments are usually between $100 and $200 per session, similar to what you're charging, Joe. But it is a cash-based modality, which is great because people see results. They're happy to pay. You can't put a price on feeling better. And for the clinics, this is what enables them to see, like we talked about earlier, the kind of range $5,000 to $25,000 per month in collections. We have clinics that go far beyond that, but that's kind of like what we like to bracket as, kind of like a typical thing. So, it works on both sides where you're in control of kind of what you charge, but just know that the patients are going to see results pretty quickly, and they're going to be like very happy to keep their treatment plans going and coming back and getting more treatments. So the last question before we wrap up is just, so what advice would you give another medical professional that may be on the fence, a little unsure of STEM, maybe hasn't read a lot of the clinical data that you have? What kind of advice would you give them if they're unsure if they should bring StemWave into their clinic?
Well, I mean, I guess I would say one, try to get to a training. Really go beyond just looking at it on paper. Get a real life experience. I mean, if you can get to if you're really on the fence and you just say, look, I need that thing to kind of really give me some convincing, uh, or go see somebody who has one and go get treated. Find if you have to travel a little bit to go find it, then obviously if there's only 600 across the country, they may not be in your backyard, but it is definitely worthwhile to go experience the treatment yourself, because it, if you'll go there with an issue of, hey, I have an arthritic knee or I have a shoulder issue or whatever, you'll be surprised at the diagnostic assistance it gives you in understanding where the location of the issue is, as well as the immediate feedback that you can get. And as a clinician, I think it will give you that little piece of additional information that you need. I mean, to say, hey, look, if this is worth me kind of readjusting and rethinking about the way I practice. I mean, we were talking a little bit about people that are doing insurance. I wouldn't try to fit this into an insurance model. I would try to look at this. This is your opportunity to provide something of value that is on a cash basis. Um, I've been able to carve out my entire physical therapy practice when everybody else in the area, for the most part, is doing insurance stuff. And everybody says, well, if you don't take my insurance, I'm not coming. And I had to get comfortable with, well, then that's fine because Joe's not going to see you. But I think from the standpoint of StemWave, I think if they get that initial experience, I mean, I think they can also reach out to any of us who are using it to talk about our clinical experience with it. But long story short, take that little bit of extra step to go, listen to some of the stuff, listen to Madison talk about it, that they will tell you there's no argument about the fact that it's effective. If you're not having effectiveness with it, it's probably because you're not doing something correctly, because the technology and the research is there, and most of us who are using it are having those kinds of results. And if we're not, we realize I have to tweak something in what I'm doing uh, to see the results.
That's fantastic. Yeah, I couldn't agree more. So if anything that Joe has said, I have said, you've heard on this call today resonates with you, if you're a medical professional that is looking for a new modality that can regenerate, that is non-invasive, that can get the type of results that Joe just explained that he's seen personally, and that we've all seen at StemWave over these last few years, it's very simple. You can just go to our website. It's stemwave.com. You can book a call with our team. It's not a traditional sales call. It's much like this. Just kind of talk about your practice. We're going to figure out if StemWave is the right fit. We have almost 600 across the country, like we mentioned. 98% success rate. And that's because not everybody is a good fit for StemWave. So we make sure that StemWave would be a good fit for you guys. And then you do a 60-day trial period. You test drive it for 60 days. You don't have to pay for it if you don't like it. If you're not getting the results that we're talking about, which we're pretty confident you will, you just send it back. It's no big deal. But we support you, like I said, with marketing. You have a dedicated account manager. We do everything possible to ensure your success. So check it out, stemwave.com. We'll put it in the chat here as well. Book a call with our team. And the process is very simple and very enjoyable, like Joe mentioned his process was. So with that, I just want to say thanks, Joe. It was so great meeting you, hearing your story. I'm sure everybody, was able to get a lot from it. And I'm excited to check back in with you, in 6 months from now and seeing how much further you've gotten with your patients and some of the things that you're using it on now.
Yeah, I'm excited too. Looking forward to it. Thanks, Ben.
All right, guys. Well, everyone, thanks for hopping on again. StemWave.com. I'm gonna throw it in the chat right now. And yeah, have a great day. And we'll see you guys on the other side.
Great. Thank you.